So I wrote 4 questions for you to read it first before we start the lecture. Look at the first question. It said a client with grave disease underwent thyroidectomy. 12 hours later, client was found to have feverish, tachycardia, diaphoretic, hypertensive, and diarrhea. What do you think is the diagnosis? This is for next gen people. They will be doing this to be able to figure out what is this. For right now, they will ask you what is the priority or how do you treat it. Second one, a client on olanzapine was transitioned to finaxin 2 days ago. She developed temperature 104, agitation, diaphoresis, tremor, and headache. What do you think is the diagnosis? The third one, a client was found to have lockjaw, temperature 104, heart rate of 120, and diaphoretic in the vacuum after surgery. What do you think is the problem? Number 4, a client on finaxin developed sudden onset of height fevers, hypertension, and muscle rigidity. What is your diagnosis? This is the problem. Why you have to know these 4 things because they look the same. I've mixed the diagnosis, I've not arranged them based on the topic. It's your job to be able to identify key factors in the question to define which one I'm talking about. So we're going to take each one of them, we'll present the case, and you can go back to this area and answer the question. So thyroid storm, very interesting idea. Basically, you have to know something about the thyroid. So the thyroid secrete thyroid hormones. So thyroid is secrete thyroid hormones. And thyroid hormones are involved in metabolism. So it increases your metabolic rate. Basically, metabolic rate is increased. And when you increase the metabolic rate, where your temperature goes up, basically you burn energy. So you use most of your energy. So any patient who is hyperthyroid, so hyperthyroidism, you expect them to have tachycardia. They can have hypertension because of the increase of metabolic rate, diaphoresis. Okay, they will have tremor. Yeah, and they will have diarrhea. These are symptoms of hyperthyroidism. All these things, everything goes up. And they will weight loss. They will have heat intolerance because they're already hot from inside due to the metabolic rate. Therefore, this is what happens when you have hyperthyroidism. Thyroid storm happens when patients who have grave disease will remove the thyroid. But when you remove of the thyroid, you manipulate the thyroid. And you release large amount of thyroid in the system. Into the bloodstream. So what is going to happen? It's going to do the same thing above as I've discussed. All the symptoms will repeat, but in the worst form. So you release large amount. So you're going to have same symptoms as above, but in a severe form of it. So patient will be feverish. The heart rate will go up. So they have had autonomic instability. That's what we call it, autonomic instability. That means their heart rate goes up, the respiratory goes up, blood pressure goes up. Okay, and all these things with high metabolic rates, they will be very anxious, They will be unstable. The reflexes goes up. Deep tender reflexes up. DT up. Everything goes up except weight. And so this is what happened with thyroid psychosis or thyroid storm. The treatment is to cool them down. So cool them down, so cooling and hydrate them. Okay, and protect these people need to be in telemetry. You have to monitor their heart rate. They will be tachycardic. You have to control their rate, so they will be in telemetry. They have to be in a cardiac unit, and you have to prevent further. Sometimes they will need steroids to control, basically damp the system up. So this is all that is happening in the patient who have thyroid storm or thyroid psychosis. And you see, it may look like the other ones. They have high fever, autonomic instability, heart rate, everything goes up except its weight. So the key factor is to see the scenario, especially the next gen people. They should now start thinking like doctors and make diagnosis. Look at the scenario. If somebody had just surgery who had a grave disease and he's showing these signs, there is no muscle rigidity. Yeah, I know this is thyroid storm. Okay, so that is in the treatment. You cool them down, hydrate, and in a cardiac monitoring, and then everything will settle down. And it happened immediately after surgery. Within 12 hours, that's what it happened. So that's the first one. The second one is classic. So you have to figure out, this is classic finding. So basically, these patients, it's called Neuroleptic Malignant syndrome. So this is very common. There's two types of antipsychotics. So antipsychotic, okay, there's two types. There's the typical one. Typical example is like allopurinol or phenylaxine. These are the old generation. These are the typical, and the atypical is the new one that we have. Olanzapine or clozapine. These are the new ones. Unfortunately, when patients are on these medication, they can develop something we call neuroleptic malignant syndrome. Whenever they see the word malignant, something that means it's a severe form of that problem. It's related to that temperature is so high that you get to do something about it. So the way these people present, they will be on this medication, then they have sudden onset. Sudden onset. Okay, sudden onset of autonomic instability, which I already told you is autonomic instability means the heart rate goes up, the blood pressure goes up, the heart rate goes up, blood pressure goes up, respiratory goes up, uh, um, temperature goes up. Temperature can go to 104 up to 105, very, very hot. Then they have muscle rigidity. Okay, muscle rigidity. That's the key word. The muscle going into spasm is just contracting too much. Muscle rigidity. Okay, that's what happened to these people. And acute change in mental status. Mental status change. Okay, so this will happen to them within a short time while they are on the medication. So autonomic instability, muscle rigidity, fever, acute change in mental status when the patient taking antipsychotic, that it just happened right away. It looked the same thing as thyroid storm, but there's a key word. The patient is doing what? Faking antipsychotic. The treatment is the same. Treatment is cool them down, cooling. Okay, you gotta bring the temperature down. So it's supportive care. Okay, these patients, all of them have to be in the cardiac unit. So they will be in the ICU on the telly. Okay, and you have to stop the medication that is causing it. But the key word is muscle rigidity. This is who you see first, patient. Who do you see is a priority patient you need to see. Okay, very, very important. You can use medication to control the muscle rigidity. You can use this medication. It's a dantrolene. Okay, it's the same thing. I want to stop basically this bind to calcium in the system. Muscle contraction is controlled by calcium. So if you can bind calcium, that will be fine. And so um, dantrolene is what is used to treat this problem, malignant hyperthermia syndrome. Okay, and this is all you need to know, that they are an antipsychotic, be able to recognize antipsychotic. These are the two: finaxin, allopurinol, or atypical, which is olanzapine. This is olanzapine. I didn't spell it right. And clozapine. They have sudden onset of autonomic instability. With all this treatment, supportive care, stop medication, and give them dantrolene. Straightforward, but you have to know what you're dealing with, be able to recognize it. Next one, you see they all have similar names. Okay, this is different. So this one, the classic, this is, I'm giving you the classic presentation. This is somebody is in surgery. Okay, this is in surgery or in the PACU after surgery. All of a sudden, the jaw is locked, or they have like um, um, muscle rigidity, the same thing, muscle rigidity. You can't open their jaw. Jaw is like completely locked. You can't open it. There's no, you can't open it, and they start having the same symptoms: fever and autonomic instability. Okay, um, the jaw will be tight. You can't do anything. They will have tachycardia, tachypnea, blood pressure goes up. Um, because the another symptom specific for this, they have hypercapnia. Yeah, their calcium, their CO2 goes up. So their CO2 level goes up because of the mechanism involved. So it's very, very impressive how it happened. But that's the number one, hypercapnia. That's number one symptoms you see, because they just coming out from anesthesia, and all of a sudden this muscle rigidity, instability, and autonomic locked jaw, and they can't do anything. So your treatment is the same thing: supportive care. Okay, and you can give them dantrolene to help with the, and you have to cool them down, cool them, have a blanket. Uh, you have to hydrate them. Anybody who has temperature, you can cool them down, but hydrate them. Because of the contraction of the muscle, there is too much potassium, so hyperkalemia. So you got to treat hyperkalemia, otherwise they will have cardiac arrhythmia. So you have to treat it. You have to treat that as soon as possible to make sure that doesn't happen. What do you think happened? Is from inhale anesthesia. That's the gas we give them for the anesthesia to sedate them. Example is allothane. Some of the inhale anesthesia is the one that causes it. So because of this, key point is ask about family history of anesthesia complication. You have to ask them, have you had surgery before? They will say no. That's it. Any member of your family have surgery and have any problem? No. So you ask them before surgery. It's very important during the pre-operative period. That's why we see them and we ask, because most of these patients, they'll give you a patient who just, this is his first surgery. So you will never know. First surgery, had first surgery, is in the surgery right now or in the PACU with locked jaw, kind of muscle rigidity, its temperature is high, and PCO2 is really high, the temperature is high, that is malignant hyperthermia. And you have to do something about it. So that's the key words: inhale anesthesia and how to manage them. That's all briefly. I'm trying to make it brief, but he has all the things that you need. And you have to ask this before whether they have anesthesia complication before they do the surgery. And then finally, this is serotonin syndrome. And I think the easy way to remember this is very important. Serotonin is one of the neurotransmitters that control depression. Any high level in the system is a problem. So any combination of antidepressant, antipsychotic, any medication that will increase your serotonin will put you into serotonin syndrome. So avoid these combination that I put together. The no SSRI plus and MOA highs. Don't do that. No. No SSRI plus St. John's wort. No SSRI plus linezolid. This combination, you should memorize it. No SSRI with MOIs. No SSRI with St. John's wort. This is used for it has high level of serotonin and it can cause serotonin syndrome. No SSRI with linezolid. Linezolid is very interesting. It's antibiotic. Okay, antibiotic. It can treat MISA or VRA easily. It look like vancomycin. See, that's the same thing. That's the same thing as vancomycin, but it has AMO eyes features. This is key. It look like MOIs. You know that you cannot combine MOIs with tyramine. The same thing. If a patient is taking linezolid, it should avoid tyramine product because SSR and MOI is causing serotonin syndrome. SSR and linezolid will do the same thing. And so, what is the actual serotonin? I call it everything goes up. The body is ramp up because this serotonin is a neurotransmitter. It increases the activity of the body. So they have the same thing: agitation. They have temperature is high. They sweaty. Okay, they had autonomic instability. Same thing we talk about. Okay, their deep tendon reflexes goes up, and then diarrhea. Everything you can think of in the body is high. They will have tremor. Their heart like they're on fire. You need to cool them down. The reason why this happens, the common combination is if usually when you transition from one medication to another antidepressant or antipsychotic or anything, you need 14 days washout period. So if you don't afford that opportunity, there will be excessive serotonin in the system, and that will increase high level of it. So if you taking MOI, okay, if you're taking SSR and MOIs, okay, so SSR and MOIs, if you're taking them and you want to transition to this, the best way is stop this for taper the SSR slowly, and after you finish, wait 14 days. The last day of SSR, wait 14 days to start MOIs. That's the washout period. So you need that 14 days to wash out the MOIs in the system. If you don't do that, you develop serotonin syndrome, which is this: everything is up, ramp up. And therefore, based on that, you can answer the questions that we had. So let's go back to them. So a client with grave disease, just had surgery. That's the scenario, keywords right there. 12 hours later, it was found to have fever, tachycardia, diaphoresis, and diarrhea. This is thyroid storm. A client with olanzapine, this is atypical antipsychotic. Right away, you know what the problem is. They're giving you the clue. They're not going to take away the clue from it. You have to identify. So antipsychotic is transition to another antipsychotic, Finaxin. 2 days ago, she developed temperature of this, that. So what is happening there? What is happening? So you have two antipsychotic and another antipsychotic. I think I made a mistake, and this should have been fluoxetine. So I was going to write SSR. So this is fluoxetine. I just saw it. So you on a fluoxetine transition to Finaxin. 2 days later, she developed fever, tachycardia, diaphoretic tremor, and headache. This is as serotonin syndrome. The client was found to have lockjaw, temperature of this, that, diaphoretic. Where is the keyword in the PACU? So this is malignant hyperthermia. A client with Finaxin develops sudden onset of high fever, temperature, and muscle rigidity. So this is atypical this is typical antipsychotic. Now with muscle rigidity, this is NMS. This one, once again, I made a mistake. This should have been fluoxetine or citrulline. It should have been SSR, not antipsychotic to antipsychotic. In any way, you can see how these four things are very important. They look the same. They can confuse you. So try to separate them in your head. Pay attention to the keywords in each of them, how you can identify them. So MH, malignant hyperthermia, somebody just had surgery with a lockjaw. He has family history, or that was his first surgery. Serotonin syndrome is taking something together with SSR. Okay. A grave disease just had surgery and he had thyroid storm. And then neuroleptic malignant syndrome, basically, they're on antipsychotic and then they have developed muscle rigidity. Those are the things you need to know and compartmentalize it in your head. Thank you for listening. Thank you for visiting my channel. Please continue to subscribe and put comments there, and come back and visit again. Take care of yourself and keep charging.